welcome back to Conscious Caregiving with L&L, where we're tackling the tough conversations. The topic this month is mental health and seniors. Welcome, everyone. I am your co-host, Lance Slatton, as well as the host of All Home Care Matters and co-host of the Caregivers Journal. I would like to also welcome my esteemed co-host, Miss Lori LeBay. Lori, always good to see you.
Well, I always love doing these shows. This is a lot of fun. For those of you that don't know me, I cared for my mom who lived with Alzheimer's disease for 30 years, and my dad with brain cancer and many others throughout my life. I am the founder of Alzheimer's Speaks, co-founder of Dementia Map, and it's just an honor to raise the voices of everyone involved in this caring journey. So I'm really excited to have this conversation about mental health today.
Yes, it's an important topic, and we have three wonderful all-star panelists joining us today. I'd like to introduce them and have them say a few words. First, I'll start with Dr. Linda Ganzenmuller.
Hi, thank you very much. Pleasure to be here. My name is Dr. Linda Ganzenmuller. I'm the president of Supportive Psychological Services on Long Island. I dedicated much of my career as a psychologist to senior citizens and their caregivers. But my caregiving journey started a long time ago personally. The day after my first daughter was baptized, we got a call that my father had had a stroke, and we converted our home to a mother-daughter living situation. And for the next 24 years, took care of my father as he had a few more strokes and mini strokes, lost his hearing, had some other difficulties. And my mother went through quite a few illnesses and surgeries, and cancer as well. But my role as a caregiver is really two-pronged, because I also worked as a professional in assisted living communities where I worked with patients with very early signs of cognitive deficits. And I met with them, and I met with others who lived in the facility. And I got to know them, and I got to know their families, and I got to look as an objective observer to see what worked between families and what people were doing right and wrong. And I learned just how profound the importance is that family members of all generations get to know and understand and care about and learn from each other, even from the smallest child all the way up to end of life. Not that I think we should give small children significant roles in caregiving, but boy, do we have a lot to learn from them. And so I hope that's something we can talk about today.
Absolutely. Well, thank you for being here. And next, I'll go to registered nurse Olivia Block. Thank you for being here, Olivia.
Hi, guys. Thanks for inviting me. I'm really excited to be part of this conversation. I'm Olivia Block. I'm a registered nurse out of Minnesota. I'm most recently a director of nursing at a senior living community where we support independent and assisted and memory care individuals. I'm also a hospice nurse, so I see the total spectrum of senior living in Minnesota. What's the most important to me, I think, when we talk about mental health is that I see, much like Linda described, is different roles of caregiving, whether it's like the healthcare side where like nursing is involved, but also families are really important kind of when you look at mental health. There's a lot that we can do as far as like medical professionals, but there's also a strong dynamic between like what we can do as far as medical professionals and how like families are involved, and kind of helping to bridge that gap between like healthcare personnel, but then also how do we support seniors specifically when it comes to healthcare and family kind of coming alongside, and what we can do to support seniors to thrive in our communities.
Absolutely. Well, thank you so much for being here with us today, Olivia. Next, I'd like to go to a good friend of ours, Ms. Christina Keys, family caregiver and the founder of Keys for Caregiving. Thanks for being here, Christina.
Thanks for having me, Lance. My name is Christina Keys, and I became a family caregiver in 2013 for my mother, who had a stroke and some mental health issues as well. The stroke left her paralyzed, and I was thrown into caregiving, no experience being a family caregiver, no medical training. I was in tech before that happened. In 2017, had to leave my career in tech and went into the retirement and senior industry. And what I found in my community, because I was struggling to find resources, what I found in my community was there was lots of resources for family caregivers, and I took that information and I ran with it so other caregivers wouldn't struggle. I founded a local nonprofit that was an award-winning nonprofit that helped family caregivers. A national company picked me up, asked me to duplicate that, and I was able to duplicate that all across the United States with over 100 other family caregivers. And I now have my own company consulting with multiple companies so we can spread the wealth of knowledge on how to help family caregivers. And I'm a national speaker and advocate. And I still, although my mother passed in 22, I still care for my ex-boyfriend who had a stroke in 2019. So although I don't have any medical training, I actually have a lot of hands-on, one-on-one training 24/7 with a couple of different patients. So I'm happy to be here.
Well, we're happy to have you here, Christina. Thank you. Well, I want to start this off by going to Dr. Linda. And if it's okay, is it okay if I call you Linda?
Of course. Yeah.
I want to go to
Please.
Linda. Linda, when seniors are starting to approach the time of their lives where they start noticing often the needs they're having or the assistance that they need or, a decline in certain abilities or functions, sometimes a family isn't the first to know. It's usually that person. And then they tend to maybe hide it a little bit because, they've been independent for 60, 70 plus years. And it's really hard to let go of that independence. But when they do decide to accept and maybe start to identify they need that help and they seek that help and maybe they come to speak with you, what do you find that most seniors choose to talk about when they come into therapy for this guidance and this, changing in their lives?
Well, adults of any age, very often what I see is that they come in, and I would say probably the majority are dealing with some type of anxiety or depression, right? As a matter of fact, probably anxiety and depression. It's rare to see them one without the other. But the difference between senior citizens and younger adults is the list of things that they're anxious and depressed about, right? When you reach the older age, you start to think about your legacy. You start to think about the regrets that you have in life. And the things that you're anxious about are very often financial, certainly health related, certainly the fear of end of life. They come to me worried about those sorts of things, not only to the extent that they impact themselves, but to the extent that they impact their families. And they worry very often about, what are they leaving behind for their children? What have they explained to their children? Did they do right by their children? And these are the things that we concern ourselves with as we get older, right? I think they're seeing that limited time left to make changes. They also struggle though with depression. Again, end of life, right? Anxiety and depression can both be impacted by the medications that they're taking. They're facing very often physical ailments, difficulties that make their life harder. And they're dealing with the grief, not only of losing loved ones, but of losing their independence, their career, their identity, their pets, their home, so many things. And so that's very much what they come to talk to me about. And in large part, it's about being heard. Certainly, everybody wants to be heard. Everybody wants their story to matter, but also in just kind of redefining the importance of the life that we have left and figuring out what kind of things you can still do, how to rectify what you can still rectify, and how to just make the most out of every precious moment that we still have left.
Yeah. Do you find that there's more seniors seeking therapy or counseling than not? Because when I'm just, as you're listening to you, Linda, we encounter countless families, with our professional job and even in my personal life. And therapy is not usually something that comes up very regularly for them to seek out for support or to get some guidance with. At first I'll say, why do you think that is? And two, have you seen a trend where it's becoming more acceptable and maybe not as taboo? Or does that go back to their generation where, you're tough and you just work through it and, you deal with it?
Well, I think you hit the nail on the head when you said that. I think it's very much a generational thing. This is a generation, I dealt for a long time with the generation that was in World War II. I see fewer and fewer of them just because, time has passed. But, they were very proud. If they didn't serve in the war, they were ashamed of themselves. They feel that they could take on anything, that they should take on anything. They're very proud and they don't like to give in. But I do find that there's a general acceptance overall. Uh, just with what's been on the news, what's been in the media, just a general acceptance of saying, yes, I do need help and I do want to talk about these things and I do want to have some new ideas about how to make my life better and how to feel better more of the time. That being said, so many of the phone calls I get are phone calls from their children who are probably about my age, children of senior citizens who say, Mom is just really, she's not herself. She had a stroke, she had a fall, my father passed away, or perhaps if it's the father, somebody else, passed away, or they're dealing with just some type of new stressor, retirement, whatever it might be. And so they're usually the first call for me. And then one of my questions will be, well, how do they feel about therapy? How do they feel about coming in? Is that okay for them? And if they say yes, that's great. And if they say that they're nervous, well, I'll welcome the child, right? The adult child to come in with them if that makes them feel better. And usually once you get started talking and you realize it's not about weakness, it's not about me telling you what you're doing wrong, then it's you form a nice relationship.
Yeah.
And therapy can be very helpful.
Right. I can just, even thinking of like with my father's experience, he was in the Marine Corps in the 60s. And I tell people all the time, the Marine Corps in the 60s is not the Marine Corps today. And, I feel like if they had a physician, starting with our medical or our healthcare system as part of, discharge instructions for some of our seniors and, having them speak to a therapist or, somebody, you might discover some issues that the doctors aren't going to notice or pick up on in a short office visit, which could help lead
Right.
to, their support and their help that they need. But speaking for yourself, what are some topics of special concern that you may have? And have you noticed any changes in those issues as, like you said, our generations are now changing?
I certainly have. And that is, I've been doing this for the better part of 20 years. And what I've noticed over the last few years is that more and more people, typically mothers, come in, mothers who are senior citizens will come in and say that their children, their adult children in their 20s or older have ghosted them. They
Mm.
just don't have anything more to do with them. Some don't have a forwarding address or a phone number. Some have been unfriended from Facebook. Some have been limited to the amount of time that they're quote unquote allowed to speak with them. And I find that this is just a heartbreaking trend that I'm seeing. And I didn't see it for 10, 12 years, 15 years. I didn't see it much at all. And it's not to say that every parent is a good parent. Some have made mistakes and that's the cause of the rift. But a lot of times I'm finding more and more these days that's not it. It's more about the cancel culture and, finding the older generation to be old and stodgy and not as open to the things that we're open to now. And rather than trying to work together, just canceling the entire generation uh, on the whole, which includes, very sadly, the parents, your own parents, who, when you think about the generation, I know I'm 58, I'll tell you that. My children are in their late 20s, early 30s. We were always at soccer or gymnastics or lacrosse or doing this or that, and thank goodness I have a great relationship with my daughters who are awesome. But we sacrificed a lot. We gave a lot to those kids, gave them a lot of time. They were a huge part of our life. And while that was happening, social media evolved, and those children didn't need the parents as much as they used to. So there was that kind of chasm in between, the parents being so dedicated and devoted and focused on the children, and the children not really needing that, not even to learn how to cook. Or, if they had any questions, you don't really have to ask your parents and grandparents anymore. You get your recipes from Food Network now. And so it's been really hard to see that because the pain of it is terrible. It's devastating.
Do you
And
see?
it's threatening too, because they
Do,
become vulnerable.
absolutely. Well, do you see any correlation to why that is now, where maybe in the past you hadn't seen it? Like, what do you contribute that to?
I really do contribute that very much to social media, to, like I said, the cancel culture of the older populations. Plus, yes, it's important. Uh, my generation, older generations, generations below me, we did things wrong. There's no question about it. And there are some things that needed to change. There's no question about that. But I think that there's a tendency sometimes to just kind of look over that generation as just a quote unquote bad generation and cancel them altogether on the whole without really seeing the good side of it,
Right.
the good side of what they've done. And again, I just feel the need for parents and grandparents, the attachment there just isn't what it used to be. It used to be that most people lived, I think, within 25 miles of where they grew up. And now that's just not the case. They're all over the country, all over the globe.
And most likely the parents or, the seniors are already dealing with some sort of health issues or, assistance that they require. And now you're dealing with this ghosting or, cancel culture. What effect does that have on, what that alienation? What kind of effect does that have on them?
First of all, the pain of it, of course, is terrible. But one thing that I think the younger generation doesn't realize is just how vulnerable people become as they get older. And I hate to say that because I feel that, so often you hear the child becomes the parent, and I'll say, but that doesn't mean the parent becomes a child. That doesn't mean that they become so dependent that they can't think for themselves or that they haven't been capable, competent adults for decades. But at the same time, their loneliness, their isolation, their need for help from others will leave them vulnerable to people, to scammers, to
Right.
people who will give them something to do that day, or for people who will intimidate them, make them fearful, take advantage of their misunderstanding of technology. And it's terrible, the things that we see, people losing all of their life savings and their homes
Yeah.
and having to be put somewhere to be safer, when that's not at all what they wanted.
Yeah, it's awful. I want to close out with you, Linda. Just ask another quick question for a viewer or
Mhm.
listener that is watching this, that is wondering if therapy would be helpful for either their family dynamic with their parents or just for their parents. How would you best answer that? Like, what are some flags or hot button words that you look for that would signify that the family may need or should look into seeking some therapy for their loved one?
That's a very good question. Anytime I can get another family member involved, I'm very happy to do that. Most often because certainly, and I'm sorry to exclude myself here, but on Long Island, it's just an expensive place to live, wherever you are on Long Island. And so I find that the parents, the sandwich generation, are just so busy with work all the time that they're not paying attention, that they're not looking at, what's going on with their parents, or even finding time to not just spend time with their parents, but even siblings with each other. Um, what do I worry about? I certainly would hope that people would have a conversation with their parents. They say if you can talk about everything, you can talk about anything. And so if you just every day, I used to call my grandmother every night at 8:30, we'd have a conversation for a few minutes. If something was wrong, I hope that she would be more comfortable saying something to me. Certainly, if they're having trouble sleeping, if they're not eating, if they don't want to get out of bed, if they're not showering, wearing nice clothes, maybe they don't put on makeup or jewelry like they used to. Those are all signs of depression, anxiety. You may even see just in their body, the physical, the positive symptoms where they're trembling, they're nervous, they're breathing heavy, they're distracted often. Those are things I would want to watch for. And when it comes to scamming, I would want to watch also. Keep an eye, get a Ring doorbell if you can. Don't just call, go there. Take a look at their financial statements if you can. Take a look at, do they have the food they need? Are their utilities being cut? Or is somebody else taking their money, in other words? So
Absolutely.
just have that open line of communication and keep your eyes open. You know what's different.
Yeah.
If they're acting different, that's the first question to answer. Why?
Do you do virtual appointments, Linda?
I do. I do. I swore I never would, but starting in 2020, we had to, and now I've learned to really like it because
So,
you do get to meet more of the people and you see where they live a little bit.
so viewers or listeners could reach out to you, and we'll have all of your contact information in the show notes as well.
Absolutely. Thank you.
Yeah, thank you, Linda. Lori, let's go to you.
Well, I just found what Linda said fascinating, and I find it so sad when you talked about the ghosting that people would rather brag about I did this recipe from the Food Network versus this is my Gram's recipe. The family values have really got pushed to the side, and it's a popularity contest now, and that just really saddens me that I see that staging with social media. So thank you for bringing that out. Olivia, I wanted to start with you because you're in senior care. You see
Yeah.
families going through this transition.
Mm-hmm.
And I want to start out with stigmas because I think societal beliefs add to all this mental health and all of this stress that is out there. And maybe I'm wrong, but do you believe that some of the stigmas involved with transition or reaching out for help as a senior has an effect on our seniors and our families?
Yeah, probably. The whole process of, getting a senior, okay, getting a senior into senior living, right? Just the name of it alone, there's so many, like in our industry, right? When you talk to other people in our industry, you'll talk to them and be like, well, what do you call the people that live in your building? Because there alone is a stigma with how you have to call the older people who live in your building. Some of it we call them residents, just like amongst the workers in our building, we call them residents because it's the easiest way. But some places call them residents. Some people call them seniors. Some people call them, and just that information alone tells you how stigmatized it is, because when older people in communities know that it's like senior living, well, I don't want to go to a place where it's individualized just for me, just because I'm older. And there's some place you have to call it a community, so it's not considered a nursing home. Our memory care is it's on our lowest level, so it's when you get in the elevator, it's actually -1. And so everyone else in the building, like our floors 3 to 1, they're like, well, we don't want to ever have to go down there. It's so stigmatized. And unfortunately, we have a very nice building. Lori, I don't know if you've ever actually been to our building, but
Oh, yeah.
it's really nice. It doesn't matter how nice your building is. It doesn't matter how gorgeous the property is. It doesn't matter how fine the dining is. We have a beautiful building. The people that live in our community are wonderful. They are incredible. They're kind, they're giving, they're well-to-do. But it doesn't matter. If you're going into senior living, you're done for. You know what I mean? And it's so unfortunate that it's that way, because the things that we can offer in our community, and there's so many other communities that offer these same things. We have a fitness room. We have a game room. We have a movie theater. We have physical therapy on site. We have 24-hour nursing. And I'm not trying to plug my building. I'm just saying there's so many communities out there that are like that. And it's like, if you stay at home, that's wonderful. I want you to thrive in your own home. But if you come and live here with me or in any other very well-to-do community, you have friends all the time. You can go play cribbage at noon. You don't have to cook your own meals. You can have physical therapy. It's just like, I hate that for seniors, it's stigmatized for them, because you can do so well in a building where you can have loads of friends and support.
Yeah, I totally agree. It's kind of, I had a friend, Daniela Greenwood in Australia, and she talked about how with ageism, seniors lose their right to citizenship. It's like they've changed. Like you're no longer a neighbor, you're a resident.
I know.
And it's like everybody wants to be in a neighborhood, everyone wants to be part of community. And we strip that unknowingly by categorizing people, so it's easier for us to target market, not realizing the effects, not realizing when an architect designs a building, like you said, -1 for memory care. Well, it's designed so maybe they can't get out as easy. I mean, there can be lots of different reasons, but there is a whole social emotional impact with so much of what we're doing that is not discussed, and it's left a lot of times to professionals that aren't really taking in the big picture of the whole person and the whole family and the community, and that is to me just a shame. I think we've done a lot of harm on a lot of levels there. So
Yeah.
thank you, because I think that that's something that we don't address. I think the flash in the pan is really important, and that's how we try to entice people. But it's not, it isn't a healthy way. It seems like it's a way a lot of times that we focus more on the family members or those that are bringing the senior to the building for them to feel more comfortable versus really pitching to the senior themselves. When I sold real estate, it was very interesting how people talked with the family and not so much with the senior in how their life would change, and yet I would see how people were isolated in their homes, but that they didn't want to talk about it. They didn't feel comfortable. Even, when Linda said, sometimes they don't talk with family as much, even when family was connected, there was such a powerful stigma in shame associated with, this doesn't fit my lifestyle anymore. Maybe the house is too big, it's too expensive, I don't feel safe on the steps, the neighborhood has changed. It could be affordability. I mean, it can go on and on and on. But when people stuff those conversations, it becomes more scary. And the reasons that I found from them that they wouldn't talk about it was twofold. One, they didn't want to lose their independence.
Yes.
And two, they didn't want to be a burden. That was really,
Yes.
really important. And I think that that's a balance in this whole mental health, again, pulling people out. And families would be, I don't want to get in a fight because I know they're not going to agree with me or want to have this conversation, because there's so much stigma. And we have developed this as being, as we age, that we are less than instead of more of.
Yes.
We're more intelligent. We have more wisdom. We've lived more of life. We should really be, in my opinion, honoring that more. And so that really kind of gets into some issues there. Do you have any suggestions for families, and especially our seniors when they're transitioning, how to deal with all of these stigmas and things that have been put into their minds? I mean, so many of them, especially our elders of our elders, they think of the old nursing home back in the 60s where people were strapped into wheelchairs, moaning, dark lights, strong smell of urine. I mean, that's still what they think because they're too scared to go visit. I'm not going to go there and look, And so how do we change that?
I think it's always going to be an uphill battle. I think because when I say we, I mean, this industry, and maybe you guys as well, because we all kind of have our little bits of, we're all here because we're gearing this towards seniors, right? We all have our little bits in seniors. Because we work at a very defined point in life, right? We have a very short window of trying to flip the script, right? But until we can prove to this delicate generation that it's different, we just have to keep doing it. And that's where, I get a very short period of time to make my mark on this generation. And we all do. All 5 of us have a very small period of time to make our mark on this generation. And
because we're going to be part of that generation.
That is not what I meant. Yes, absolutely. that's not what I meant. But like every single one of us, we decide to work with the geriatric community because that's where we want to be. And we have, the grit and the determination to say, this is what we're doing. This is where we want to be. This is where our heart decides we want to be. And so we want to. And so, I say, I want to change this stigma, and it's frustrating, but that's what I decided to do. And so every day I get to still keep doing it, and so Lori, I don't know if you know this about me, but just for all 5 of you, since I was the director of nursing, I would go out and do all of the assessments to bring the individuals into my building. And so, when they would do the marketing, the tours, the meet the family, your loved one should come live here, then I would go out and I would actually meet the individual and determine if like physically they would be able to, if we could actually physically take care of the needs that they desired and the things that they wanted. Right. And so I would get to meet them. I would meet every resident face to face. Right. And so I would hear, much like, Linda, you would like hear, oh, this is what I think is happening with my loved one or whatever. Then I would actually be like, here's the actual loved one. And you hear different things, right? Family says they love board games and they like watching birds, right? But then when I actually meet them, it's, who do I sit with at lunch? What if I have trouble going to the bathroom? You hear the actual concerns, right? And so being a nurse, you have this they have an automatic trust in you, okay? Which is, I love it. That's great for me. That's what I decided to do when I took on this career. And so you get the very special opportunity to say, we have loads of wonderful people in our building that will love to sit with you at lunch. And you get to look that individual dead in the eye and know that that's accurate. They don't care if we have 4,000 puzzles in our game room. They just want to know who they get to sit with at lunch. And so I think, we can hike this uphill battle every single day and try to change the stigma of it's scary to move into senior living, but it's sometimes those one-on-one moments where it's like, it's going to be okay. There's going to be people to sit with at lunch and we'll help you get to the bathroom. We will. And I know I can sit here and tell you we will, but you won't know until we actually show up for you. And I think it's every day. We just keep showing up for these people because at some point, these elderly people, you guys, they showed up for us every day.
That's a great point. And I think so often they want an authentic conversation. They want to actually be heard and they want to feel safe being able to say what they need to say. And in this fast-paced world, we don't always feel like anybody has time for us. And this is happening at all ages, not just our seniors, but it really affects our seniors when their word, if they said something, they stood behind their word. And we don't see that so much these days with people of all ages. People will say stuff, but they don't actually follow through, with what it is they say. And I think sometimes too in senior housing, and this has been a huge trend for a long time, but it was like, oh, we're gonna bring in hospitality. We're gonna make them happy. We're gonna meet all their needs. And they don't want fake happy. They want real relationships. Granted, they want to be treated well, but there's a really big difference in terms of actually knowing personal dynamics and just feeding somebody what you think is flashy and that they should be happy about. And different generations value different things. Mm-hmm. And I don't think that is always taught. So I love, when we hear like people like you choosing, this is who I choose to serve. This is why I value these people. And I don't think we always get that in many of our industry factors. If it's senior housing, if it's medical, if it's grocery stores or banks or whatever, that commitment to serve has kind of shifted, and people don't really realize the impact that it has on mental health, because you're just another, cattle in the cattle prod. You've lost your individuality. You've lost a lot of that one-on-one, which I think is so meaningful. And especially when people are going through big transitions that are scary, if it's health, if it's move, if it's a death, all of those things, they're big, major things, and they need to have an outlet where they can laugh and cry and be frustrated and not be shamed, not be embarrassed. And it seems like we've lost a lot of our time to do that, with a lot of micromanaging too that goes on in the world, or fakeness of they'll listen, but then they turn around and they like forgot everything that was said. And so I think all of those things are really important. I wanted to ask you one other thing too, because I know that you worked in pharmaceuticals for a long time. And a lot of times, again, and I know you're not, and we can talk about this kind of in the second half too, but I thought I would just tee this up. A lot of times in communities, or even when people are living alone, people are deemed to have behaviors when it comes to mental health. And so they are placed on a pill. And, what are your thoughts? Because I know in senior housing, once you are diagnosed with mental illness, that can have an impact on where you can live or not, depending on what kind of symptoms you're showing. And I've seen people be over medicated or getting wrong medications. And again, I'm not a medical professional, but I know, for example, with Lewy body, if it happens to be dementia, there are certain medications to stay away from. And yet there seems to be all this talk about not giving as much medication, which I think is great. But are you still, I would imagine that's still out there and a factor, though. For some people, they need that to be balanced. And how is that perceived these days in senior housing?
So it's timely that you brought this up. It's really challenging, actually. We've had actually two situations really recently that have really kind of hit me a little bit hard, only because when you're in senior living and you have really difficult mental health issues, just the environment of senior living, while it's very beneficial, if you have really difficult mental health issues, whether that be Lewy body dementia, like you mentioned, that type alone can be seriously unpredictable, and you don't know really what you're working with any given day. And then also schizophrenia, with no relation to dementia. You're working with two really difficult things. And when you're in senior living, you have to kind of work with those two types of different things. It's difficult only because you're sitting in and I'm speaking from director of nursing, and just a regular nurse. Mm-hmm. You're put in a situation where these individuals are in my community to help support their health and their living. And so there's a pull to say they're here to be supported and protected, but there's also a pull to say, when do I make the call to send them somewhere else to get them more help? It's a tough call to have to make, and it's a tough balance. Those are the instances where it's really helpful and it's really beneficial to have a very, very supportive family dynamic. And in both of those situations, I've seen one that's very supportive and I've seen one that's been very unsupportive. And when I say supportive and unsupportive, I don't mean that they don't love or unlove their loved one, right? It's just the support looks different. And so, and it only looks different from my opinion. And that's where it gets really challenging. I think that medication can be very, very, very beneficial when you're looking at some extreme mental health conditions. It's just, as far as Lewy body dementia, which in and of itself is kind of hard to medicate. You can't really medicate Lewy body dementia, but you can help manage some of those symptoms that they experience sometimes. And then schizophrenia, those are two kind of hard ones to work with. And so it's helpful to have a good family dynamic. And when I say good family dynamic, that's like easy to talk to, easy to communicate with. And it's hard to work with the heart of how I want to help these people, but then also kind of understand that they're individuals. Their family loves them a different way than I do. And it's a hard balance, Lori. It's hard.
Yeah.
Medications can be helpful. They can be hurtful. I don't always have the right answer. It's hard to manage in senior living. It involves a lot of communication. It involves a lot of kind of stepping back and just kind of looking at what everyone kind of wants to see.
Okay. Well, we'll dive deeper into this in our second half, because I think that'll be interesting along with social prescribing. But let's go ahead and pass it back to Lance.
Thank you, Lori. I want to go to Christina. Christina, you've been a family caregiver for a mother, an ex-fiance, a lot of people in your life that really led you into the senior care sector, because like you said, you were in tech before any of that had ever happened. And now, here you are, a champion of caregivers, and some would even say you had the keys for caregiving. But I want to start with kind of asking you, how do you advocate for seniors when healthcare professionals disregard the patient's medical needs by saying, it's just anxiety, it'll pass, or, and there might be something more going on, or maybe the anxiety is that severe, but it's just getting disregarded?
Well, I would say first thing is to take a deep breath because I think anybody who cares for their loved one knows that, of course, they're going to be having anxiety. If they didn't have it before, because my mother, she suffered from some mental health issues, right? And one of the things she had was anxiety and depression, right? But she also had a stroke. Her independence was taken away. Half of her family and friends no longer really came to visit her anymore. She wasn't able to get out of bed very easily. So all of these things caused anxiety. She also had a medical condition called vocal cord dysfunction, where at any time half of her, throat would close up, right? And so, yeah, these things are going to cause anxiety, but there were other issues that would come along with it, right? And so for me, for instance, I'll give you an example. We were in the hospital. My mother, as you know, sometimes for seniors, when they get a UTI, it presents differently than somebody who is younger, right? And my mother was paralyzed on one side. She was bedridden a lot of time, and she'd gotten a UTI. Well, my mother, because her stroke was so bad, they had only given her like 1% chance to live when she had her stroke for the first 30 days. And what happened was she had a lot of seizures, but her seizures would ramp up when she had the UTI. And I was usually pretty good at having that 48-hour window of, if I can get her the antibiotics, then she doesn't have to be admitted to the hospital and get the IV antibiotics, right? And one day I tried to get her the antibiotics in time. Well, if you give somebody antibiotics and then they go to take a urine sample, it's not going to show up that they have a UTI, right? So I have her in the ER, and my mother's having all these seizures. And I tell them that she has a UTI, and the doctor comes back and says, she doesn't have a UTI. She just has anxiety. We're going to discharge her. And my mother's seizing. And I said, look, I care for my mother 24/7. She does have a UTI. Here's why it's not showing up. Short version is that doctor discharged my mother. It took 4 nurses to put my mother into the car with me to drive her home because she was seizing so bad. And I was supposed to take her home while she's having seizures and drive her. Yeah. Right. And so, now what I had to do was make sure, like, I brought documentation and made sure that in the beginning, when I was a caregiver, all of those things were triggered because all I could think was, that's my mother, she almost died, and I had to learn how to speak professionally. I had to learn how to calm myself down when I'm talking to these medical doctors, because inside I'm going, don't let my mom die. Inside I'm functioning as an 8-year-old who's scared, to death. Right. And so I had to really learn how to talk to all these medical professionals. And I also had to learn that they weren't necessarily the authority, that sometimes the doctors in the hospital, especially if they were hospitalists, they have 15 minutes to see the patient, right? They don't have a lot of time to analyze this. It's really not their fault, right? But if I'm not able to communicate and I've done everything I can, I've shown them some of the binder that I have, I've told them some of our baseline, then it's time for me to call in a patient advocate, because what a patient advocate can do is be the mediator between the doctor and myself and just help us to communicate better, right? Because there are issues that are going on medically. And yes, she does also have anxiety. But what I found is sometimes some of the medical professionals in the hospital, if they just have a short amount of time, or if the ER is busy, she just has anxiety equates to, we don't have time to treat her, or we don't have time to figure it out, and we're not going to dedicate the time to figure it out.
What about the other side of that coin? As a family member or a family caregiver, how do you set those boundaries with your loved ones who are suffering with mental health issues while you're caring for them? And, there's two sides to that, really. How do you not allow yourself to be used or mistreated? And how do you also set the boundaries so that they'll respect what you're saying?
Well, I have a different sort of situation. Well, actually, there's a lot of people who were in my situation. My mother was my abuser growing up, right? And so when before I became her caregiver, through a lot of great therapy, right, I was able to learn how to set boundaries, and I was able to say to my mom, if you do this, this is what will happen. If you do this, I will do this, right? And she was able to understand. And when she did those things, I would, do what I had said I would do. And we were able to function that way. Well, when she had her stroke and she had cognitive issues, she couldn't remember a lot of things. I couldn't really set boundaries with her, right? So she had not only the memory issues that came with the stroke. My mom, I remember one time she was sitting down doing her taxes, and she had been frustrated. Now, my mom was an aerospace engineer who had one of the highest security clearances on the military side that anybody could have in aerospace, right? She was brilliant, right? Sitting down to do her taxes. And for months, she wouldn't let anybody help her. And I finally said, Mom, what's going on? And she said, Tina, I am losing my mind, and it's so frustrating. I can't do simple math, and I don't have a way to stop it. Right. And so, her mind isn't working properly. Right. And so I can't set boundaries with her. So this was a whole nother journey for me. I had to set boundaries for myself, because I can't say, Mom, if you do this, I will do this. Because if I did that, 10 minutes later, she might be having some memory issues, and I could set them all day long, and it's not going to work. And then the role reversal that I believe that Linda talked about, where it's like, no, they aren't a child, right? But the role reversal, I am showing up as a parent right now. That comes into play also. So having to learn about setting boundaries with myself was really the biggest thing. If she does this, like if she acts out, right, then I need to know on those days, if she's on a 3-day bender of she's just not going to listen, she's just not going to take her meds, she's just not going to drink her protein shakes, then I need to know that I need to be talking, make sure I'm going to my peer-to-peer support groups, make sure I am, talking to my one-on-one friends, make sure I'm talking to my therapist, make sure I'm taking some time to breathe and journal and pray before I go over there and cry in my car afterwards, dedicating that time so I can still provide care for her.
Yeah.
So
when you look back on those early days when you're still in the tech sector and you're just discovering what a family caregiver is all about, What was the one resource, and I'm sure there were several, but what's one resource that really stood out to you that you initially found in your very early stages of caregiving that really stuck with you and really provided the most benefit?
Um, to be honest with you, in the early days, there wasn't anything. In the early days, those first 3 years, I was kind of on my own. And that, honestly led me to 3 years in being told by doctors that I had 6 months to live. So, but I can tell you once I got into the industry, and this is very common. I've
Mhm.
talked to caregivers all across the United States, and they say all the time they really didn't start finding resources until they became someone who worked in the industry. It was hard for them because we automatically think that we ask the doctors at the hospitals and we ask the people in the healthcare profession, right? And they don't even like really think if they get the luxury of getting to use a home care agency, right? They don't even think to ask. Hopefully, the home care agency is smart enough to say, hey, here's a list of some resources in town, right? But some of the resources afterwards I found that were so helpful, especially dealing with mental health, not only for my mother, but for myself, were finding those peer-to-peer support groups, right? Finding a good therapist who understood, right? And there are therapists who don't understand. I had one therapist, her thing, she kept saying, just why don't you just put your mom in a home? This is not a good match
Right.
for somebody who's a caregiver, right? And so also using things like the Caregiver Action Network's hotline. If you're taking care of somebody who's Alzheimer, the Alzheimer's hotline. Also NAMI, right? There's usually NAMI that you can, and hopefully we'll have that number resource there. But yeah, all of these things, and being able also to, like, one of the things that really helped me too was having a friend that was also on that journey, right? That I could call and vent to, who understood, right? It was so important for me to take care of my own mental health because listen, I I had anxiety now. I had depression now. I had PTSD now. There was all of these. When you're watching somebody who's slowly declining that you love, when you're constantly going into an emergency, coming out of an emergency, preparing for an emergency, or recovering for an emergency, and you're on call 24/7 for any of those, you could possibly acquire some mental health issues,
Sure. Right.
right? And so it's important to not only to be able to provide the best care possible for the person you love, but also to give yourself a fighting chance. Because I think, some of the stats for family caregivers are like 30% of family caregivers pass before the person they're caring for, 35% pass within 5 years of the person they're caring for. And if you're over 70, like 65% of the caregivers pass before the person they're caring for. So it is very, very important to take care of ourselves. What you're doing, if you are dedicated, and that's the thing about caregivers. They will do anything for the person they're caring for. They will give up their lives for the person they're caring for. But if you want to take your care to the next level, it's very, very important for you to remember to take care of your mental health as well by finding those peer-to-peer support groups, reaching out to places like Caregiver Action Network, the hotline, finding a therapist. Also, another lovely resource is care coaches. Care coaches are wonderful. They are people who have been on the journey of caregiving. They have been through the trenches, right? They have dealt with the difficult parents. They've dealt with the hospital systems. They've dealt with all the crazy, dealing with medical insurance. They've dealt with all of that, right? And
Mhm.
they can help you walk through that
Right.
on a level where they understand. They don't, so yeah.
Aside from taking care of yourself first, because I always say that's my number one tip, because without your health and your ability, your loved one's in trouble because you won't be there to help them. What would be
Right.
your other advice to maybe somebody just starting out on this? Maybe they got the news this weekend that mom's, dementia has progressed or mom got diagnosed with dementia. What would your advice be to them after number one tip, taking care of themselves first? What would be your advice?
My advice would be, and a lot of caregivers don't know this. You are not alone. There are over 53 million of us in the United States who are caring for loved ones. Doesn't matter what your situation is, right? Doesn't matter if you're, you know, 40 years old in Sacramento taking care of somebody with Alzheimer's, there's somebody just like you, right? So, and it doesn't matter if you go on social media and just look up caregiver support, or you find, places like Daughterhood who have Zoom support groups. First thing I would say is find a peer-to-peer support group. Somebody who, when they say put on your oxygen mask, they don't just say that they tell you where to get that oxygen mask, when to use it, how to use it, how often to use it, and who else can use it. And if you run out of oxygen masks, how to rebuy another one, right? Peer-to-peer support group. Most important thing, if I would have had that, not only would I have, it helped my mental health, it would have helped with some of the financial mistakes I made. It would help me to find resources, so many things. And it really would have helped my heart.
Yeah.
It's hard on our heart when we're caring for loved ones, right?
Absolutely. Well, Christina Keys, thank you so much. I'm going to go back to Lori, and Lori, you're going to open it up for discussions.
Oh my gosh, that was I loved your advice about the peer-to-peer support, because I know for myself, when I was caring for my mom, I viewed support as another task that I had to do for the person I was caring. I did not see the relevancy of how that was going to help me. It was just like, I can't squeeze this in. And I had no idea of the value and the richness and the comfort that I would feel from having a support group. And at that time, I mean, I was a professional. I should have known that. But we don't talk about what people receive out of that, I don't think, enough. And I think too, with that, sometimes I go back to the example with my folks even getting their will done. Oh, no, we don't need that. We don't have that much, or, they want to keep it private, all of those things. And then my husband and I said, we're gonna update our stuff. Let's just all do it together. And when we did that, it became comfortable, and it now wasn't an end of life, or it's this situation is to blame. It was a smart living. So I think sometimes as care partners, caregivers, carers, whatever you want to call us, we think that we have to have everything in control. And that way we will make the person we're caring for comfortable. But I think sometimes being vulnerable and saying, I need support too. I'm feeling overwhelmed, and this is about you. It's not about me. So I can't even imagine where you're at with all of this stuff, but I'm going to look for some help. And maybe that would open the door for them to be able to do that too, realizing, just stating the fact that I'm feeling it at this level. I can't imagine having this diagnosis or being looked at because of ageism or whatever it might be. Might just, pull the curtain back a little bit and make it a little easier to have that conversation. So thank you for bringing that up. I'd like to kind of open this up, and I want to start with, I kind of want to go back to the pharma piece and pull Linda in, because I'm sure you had some thoughts about mental health and prescriptions as well. And again, with anything we're talking about here, guys, there's the good, the bad, and the ugly, and you can find it all out there, and our goal is to help you find balance and options, because everyone's situation is different. So there isn't one magic little thing any of us can do. But I think there's a lot of little magical things that we can all do to not only help our situations, but to help society at large deal with this massive, massive issue of mental health with seniors. So Linda, what are your thoughts regarding pharmaceuticals in seniors? Because I've heard that, what they took at one time might not work anymore, just because of the age of the body and the way it metabolizes things. And there's so many things that we don't even think about. We're like, well, you took it before, just take it again, type.
Yeah, right. Well, as a psychologist and not a psychiatrist, that's not really my field of expertise, but there are some things that I have definitely seen. And that is that some places are quick to medicate without bothering to find out, if there's just a simpler reason. for the behaviors of the person, we know, and this is, I think, what we really have to look for. The bottom line is, are we medicating that person for their benefit, or are we medicating that person for our benefit? And yes, certainly sometimes there are safety issues involved. I know Olivia spoke about some of the more serious ones, but we know if we're giving medication for the right reason or for the wrong reason. And the thing about psychiatric medications is you can't take it for a month and then get a blood test and know if it's working. The only way you know that psychiatric medications work is by the report of the person who's taking them and the people who observe them. And again, doctors, they don't have a lot of time. You might have a 15-minute appointment if you're lucky, and you could say yes, no, or otherwise without really knowing. So I always advise my patients and their families, if I'm allowed to speak to their families, to please take really good notes and to notice and even mark things on a scale of 0 to 10. How bad is my anxiety today? How bad is my anxiety when I do this? So that you have a more concrete measure of whether something is working or not working. And we need to really, I mean, what keeps us from medicating these people is education. Right. I remember seeing something on YouTube with Teepa Snow, who where they had this man who was a big man. I believe he was about 6'2" or maybe bigger, and he would be very combative. And the tendency was to want to medicate him because he was combative before dinner. He didn't want to get up for dinner. And she walked into the room and she said, that chair's too small for him. His butt is lower than his knees. He can't get out. Just get him a higher chair. And why is his walker all the way over there? And sure enough, they got him another chair. They got him a walker. He was never combative again. So education, understanding, and a well-rounded staff. She's an occupational therapist. I'm a psychologist. There are nurses. There are caregivers, just people who know these people very well. You combine all of that information and hopefully you can come up with a solution that is not about medication. Not that it doesn't have its place, but we need to know when that occurs, when we cross that line into needing medication. Will it help them? Will it make their lives better? It may. Being less anxious and less depressed certainly can make your life better. As an adult, not necessarily with dementia, what I see often is people will take medication, and when they're feeling better, their therapy is better. I say the rubber grips the road a little bit better. And then with therapy, they need less medication, right? So you want to kind of find that balance of how much can you do for yourself and how much do you need to medicate, and maybe not eliminate the medication altogether, but minimize what you need and just come up with strategies that make your life better overall.
Yeah, I think that's really important. And like you said, some of the symptoms are, or what we term behaviors, which I hate that term too, because that's just such a negative thing, are just ways of people communicating. Because sometimes people, when they age, they, especially like if dementia would come in, some people lose their ability to communicate with words. And so how do they get that across? Or if someone's had a stroke. And I remember there was a woman in the nursing home where my mom was at, and she had a wheelchair with a tray, and she would bang on that tray, and she would just be screaming, and it would irritate so many. But she was trying to tell everybody she needed something. Something was not meeting her needs. But instead of trying to figure out what that was, going up, looking in her eyes and going, do you have to go to the restroom? Do you need to be changed? Are you hungry? Are you thirsty? Are you cold? And a lot of times it can be environmental. I mean, it can be lighting, it can be sound, it can be really simple things that people are not paying attention to. And it's just like, I can't remember who said, I think it might have been you, Linda, why are we medicating? Is it for us or is it for them? If it's for us, it's give them a pill and just get them settled down. If it's for them, we're going to, like you said, figure out the why. Because so often the medication isn't needed. It's a communication that is needed. It's and when we add these medications to people's regimes, they can have contraindications and situations can arise from that. So it gets complicated really, really quickly. And I
Yes.
think people need to look at that big picture. I also wanted to talk a little bit about, because we've been talking a lot about therapy and stigmas. I know people are struggling even when they get to the point of, okay, I'm going to get a therapist. I can't get a therapist. There's not that many of them. You know, they're booked out for 3 months and then people give up going in. Or I know here in Minnesota, and I've heard this really throughout the world lately, that a lot of the psychiatric hospitals are closing. And so people who have major critical issues are just being thrown in with the general population, which is not a good mix. And there really needs to be an expanded population of professionals that deals with geriatrics because their needs are different. Anybody have any comments on that? Any ideas?
It's hard to find geriatrics at all, geriatricians at all, whether psychiatric or otherwise. It's just not a population that people tend to work towards. I love what Olivia said before about having just a short window to contribute to that generation. I think you really just said it so beautifully. This is a terrific generation of lovely people. I love spending my time with them, and I have for the last 20 years. We do need to take better care of them. It's very hard to find, though. Psychiatrists, I think there's one geriatric psychiatrist I know of right now. Others who do their best, but aren't really familiar with the problems of geriatrics and certainly not with the problems of dementia. And so I would love to see that happen. And we're in a situation right now near where I live. Just Long Island is very skinny, right? But from the north to the South Shore, there were 3 major psychiatric hospitals that all closed. And we have somewhere about, I don't know how many thousands of beds that was. Those people they didn't stop existing. They're just in the community right now and they need help. And it's been a while and they're getting older. And so the crisis of needing more mental health, and we can look at that in the news right now, all the terrible things that are happening. It's a genuine crisis. It's a crisis in general and certainly a crisis in geriatrics.
Okay. Christina, any thoughts in terms of your journey, in terms of how did you get connected, for mental health? And I hear it from my support groups all the time. Oh my gosh, this is not an easy process and it's not helping my mental health, but it's so difficult, because they're looking for an answer and they think, well, there should be an easy solution. But most of them say it's just, it adds to their stress. And so a lot of times they just forget it. I can't deal with this.
Well, and for me, when I left my corporate job, I also lost my medical insurance, right? And I went from making $100,000 a year to maybe $16,000 a year, right? And so I was on state insurance, and state insurance, trying to get mental health therapy on state insurance, you're waiting forever for a therapist, and then the therapist you get is somebody who's right out of school, most likely, has not had a caregiver journey. Not that all of them have not, but so that was very difficult. And so, and then again, the time too. I'm grateful for Zoom actually, because it's so much easier, right? And so one of the things that I had to do was, again, the Zoom peer-to-peer support groups, right? And then Facebook support groups, right, that were on social media, right? And then also when there wasn't time for that, because sometimes I was in the hospital and I couldn't be listening, I couldn't be participating, right? Wonderful things like, I don't know, podcasts, right, were wonderful to listen to and hear some of the things that other caregivers are going through and some of the things that, they were using for solutions as well, was a way for me to stay centered and just, obviously if I'm having a crisis, I want to call one of the crisis lines, right? And so, but if I'm in the hospital, there's somebody there that's going to help me if I'm in there with my mom, right? But yeah, definitely the peer-to-peer support groups, because when your finances are affected, and many family caregivers' finances are affected, it changes the resources you have for getting mental health therapy. So,
Okay, thank you. Let's talk a little bit about social prescribing. Has anybody been involved with that? I know in Massachusetts they're doing some pilot programs on that, and social prescribing is really not just getting a prescription for a pill from a doctor or to go to rehab for a doctor, but maybe to go to a support group, maybe to cover some of the different social aspects. It might be an art class, something to engage people in. And, what are your, have you been involved in any of that? I know that it's really kind of experimental and things right now, but what are your thoughts about those things helping mental health? And I know, Christina, you have to make sure that you hop off at the top of the hour. So I'm going to go to you first because I really want to hear your thoughts on what that group participation can do. You talked about it for support groups, but what about other types of gatherings?
for family caregivers,
And or the seniors, that we're
well,
talking about.
well, for my mother, it was important for her to remember that there were reasons to find joy in life. You know what I mean? If she was in that social setting, she was social before her stroke, right? And she had some lovely friends who did occasionally come to visit, right? But afterwards, not so much. So for her to get together with people who were doing crafts or who were doing paintings or whatever, it helped her to calm down. I actually, one of the things I did for her mental health, because she would not go to a therapist, and really, frankly, wheeling her into a therapist was not conducive to her medical condition, right? Was she had American Girl dolls, and I created one of her rooms in her house to be a doll room that she could set up all these rooms. She called it her doll room. I called it her therapy room because she could go in there. She remembered joy. She remembered she was so peaceful and calm in there. She was able to remember. I mean, there were so many benefits of her being in that space. So
Okay.
that's
Thank you. Olivia, how about in senior housing? I mean, I've heard of a lot of them are pulling in, physical therapy or exercise programs, art programs. I mean, intergenerational. I mean, some of the communities even have a day center for the little ones where people can do volunteering and things like that. What are your thoughts about getting people active in terms of participating in social activities?
Yeah, so we actually have at my building, we actually have an extensive activities program just in existence already. We we have an activity. Well, she's a life enrichment director. That's what we like to call it, life enrichment. We try to, so those kinds of activities, social, like painting, art stuff. We have that movie theater, going to a movie with your friends, dining, we just had like a huge Mother's Day brunch. It was gorgeous, right? We threw this individual who just turned 100. We threw her a birthday party. So like those events, like those things in life, it's speaking to our emotional needs. So those, I guess I didn't really realize it was like social prescribing, but like we do those things because we need the seniors of our community to have their emotional needs fulfilled as part of like their care. So like we have stuff, activities, calendars that's really kind of standard in senior living. And so we very much encourage that. Like we have like one person, a director in our building, solely dedicated to making sure that those types of things are available for our seniors. And she plans outings. Like yesterday they went to this Mediterranean restaurant. Like those things in senior living are like very important. We have scheduled fitness things. We have like speakers come in. Like last week we had like someone from our pharmacy come in and speak about diabetes. And so we're constantly trying to make sure that there's like a rotation of like different types of things that like try to, speak to everyone's kind of, whatever their little niche is, whatever, if it's movies, if it's games, whatever it is, we just try to keep it exciting and different for them.
Yeah, adding that variety, and you don't have to, you might not have diabetes, but you might have a friend who has diabetes.
Right.
So it's good information to have. It's giving that inclusiveness. I remember when I sold real estate, people would go into senior housing kicking and screaming so much of the time because of the stigma. And I was in that line of work for 25 years. But the funny thing is so many of the people living alone didn't realize they were isolated because it happened so slowly. And so then when I would need to get a hold of them for a purchase agreement or something like that, I couldn't reach them because they were never home. They were always out, having coffee or, on an activity. And family would say, oh my gosh, they just blossomed. And I think so much of the mental health issues, and again, I'm not a medical professional, just has to do with feeling like you fit in and you belong. And a lot of these things are really simple remedies that we seem to not recognize the importance of them. And they are massively, massively huge, I think, in that. So I appreciate what your community is doing. And I'm really excited to see the social prescription being piloted to see the effects, because I've heard it. I'm sure, Christina, you've heard it, you've felt it, you've seen it with all the people that you two talk to. Same with you, Lance, in terms of what people get, or the patient advocacy that we're seeing, where people are being pulled in to speak about their situation. Giving a voice to people is so huge, and can change their mental health journey, I think, totally. Lance, I'm sure you're dying with a couple of questions over there, or comments.
More or less just a comment, about the social prescription. I think in a way it's also sad that we have to have a program called social prescription, because like, we've talked about earlier with Linda and different things, when they're ghosted or they're getting canceled by their family, or they lose their ability to drive or to go out on their own, that's where that need for the social prescription comes in. Otherwise, you wouldn't need a program like that if they were getting the family support and community support that they need. I know here where we're located, our local senior center has a beautiful state-of-the-art bus or shuttle. It will go around Monday through Friday, picking seniors up, no cost to them, take them to the mall, take them grocery shopping, because of that very reason. If they're not able to drive any longer, or, whatever the situation may be, they're still able to get out and engage and either go to the senior center or go to the mall with a friend to see a movie, or just walk in the mall when the weather's bad. I think it's crucially and vitally important, but I just think it's also a little sad that you have to have a program called that, because these are things that we should be looking out for our loved ones to begin with.
Well, and I think it's something we used to do. I think of even the churches, so many people, as they age, can't drive anymore. There always used to be someone that would be like, I'll come pick you up, and now they're kind of forgotten.
Yeah.
And that is such a critical piece for so many people, that spirituality aspect being part of their community, and just knowing that you're missed,
right?
Knowing that you matter, that's really, you'd come and pick me up. I mean, that in itself is, I think, massively huge. Linda, you look like you have a comment.
I just wanted to add on to something that Olivia was saying before, all those fabulous programs that you have in your community. From a therapeutic perspective, anything that's expressive, whether it's art or music or writing or whatever, it can only come from within you. There's no other place for any of that information to have come out of your body and onto paper. And so it's a wonderful way of expressing yourself and your thoughts, and a great way sometimes to get an insight into what's going on in the internal world of our seniors, or anybody for that matter. But I also want to add on to what, well, Lori, you've said it, but I think everybody's mentioned it. one thing that I've learned about seniors and everybody is they really just want to be heard. You know, these were people who built up a career, who became parents, who gained more and more and more and more knowledge, and then at some point just hit a wall and nobody was interested in their knowledge anymore. And to give them the opportunity to have what is inside them, A, come out, but B, be recognized is just so important. Everybody wants their story to be heard and wants their story to be respected. And if we give them the opportunity to do that, that just gives so much more value to their lives.
Oh, I totally agree. Is there any topic that we haven't talked about regarding mental health that anybody wants to address? Because otherwise, then one of the things I want to ask everyone is, what have you seen changed to benefit, and what has triggered that? And the reason I say what has triggered that, because I think COVID triggered a lot, because people
Yes.
who didn't have mental health issues all of a sudden had mental health issues because of the isolation, and they were stepping up to volunteer. But now it's been a couple of years and people are pulling back and getting sucked into their own life again and their own routines. And we seem to have lost something that, to me, that could have been captured and maintained, and it wasn't, in terms of pulling people in to support one another more. And again, maybe it's just my skewed view on that. Olivia, thoughts?
Yes. um, so actually speaking, I mean, we keep saying stigma, and I know we're all trying to like get away from the stigma of this, but COVID, I mean, I know it damaged so many things, right? Mental health, our ability to like believe in healthcare in general, but it totally, like, if there was any belief in like senior living, it completely damaged it. Like, the fear that elderly people and families have in senior living alone, because when people, like, when their loved ones were in senior living communities and we shut them out, it was like, sorry, you can't see the person that you love and who's old and is maybe dying, and you can't come see them. Like, the potential for that to happen again, and for the frailest group of people in the world to say to them, sorry, we know that you've given us your entire life, but you can't see the people that you love. Who would want to come into a building like that ever again and risk that happening ever again? Like, COVID was so damaging for that aspect alone. Like, it's just now, like, I had a conversation, a while ago with my sales and marketing person, and I was like, the Centers for Medicare Services can never again shut down senior living communities, because it was so damaging to people and their mental health that they can never do it ever again, even in the event of like a pandemic.
Yeah. And, as sad as it was, I think it was a good lesson for us to all learn that we need one another and what we value in life. And, we weren't learning that. We didn't value that before. And now people understand that, and it makes things really, really complicated. What do you guys think about, I'm from Minnesota, so we had the whole George Floyd incident there, and we've had other incidences, and we've seen it around the world, where now police are having social workers and people there to help with mental health. Are others seeing that being helpful in terms of dealing with seniors? Because again, mental health, it doesn't have to be just when someone gets shot these days. So that seems to be the only thing on the news. But there are so many mental health issues out there that I think are, it's important for our police and our fire and, our EMTs to be educated on and to have the support they need to be able to do their jobs as well. Are people seeing that as a positive? Linda, what are your thoughts?
Well, I'm thinking about one situation in particular, without giving away too much information, where there's a young man in our neighborhood who is, I don't believe, very dangerous, but he's young, but he's very, very big. And the things that he says might be a little bit bizarre. And I'm in an office building with a lot of psychologists, and our fear is that the police will come in and not understand, that he's probably not a threat. And we pray that, our first solution would be to, well, hopefully gather together our abilities to work with this person, but even more specifically to know who is best qualified to work with this person and maybe alleviate the situation before anything else happens. Because I know that there were some people who were very quick to say, nope, the cops have to come. This guy has to be out. He's a danger. He's, and the overall belief of the people in the building who are trained in psychotherapy are more worried about, calming the situation before it escalates too far, because I can just see it going really badly,
Yeah.
especially just simply because of his size. I mean, his behavior is one thing, but his size is really where the threat lies.
And a lot of people don't know this, but you can call 911 non-emergency and let them know. Let's say you have someone with mental health issues, you can register that person, have that in their notes. So if they ever get called out to the house, or the building, they would know that maybe they need to call in different support with the police, that this is the situation. They can do that with all kinds of stuff, but mental health is one of them, dementia, all kinds of different things. Maybe they're fall oriented, or the police just say that really helps them to have that knowledge. And along with that, you can give backup people to call in. So if there is an emergency, or nicknames, or things that they like to talk about to help calm them down, they'll take all those notes in. And that's, to me, I was shocked when I heard that. And I thought that was brilliant
That's very
myself.
good to know.
Yeah. Well, I know that we need to wrap up here. Lance, do you want to, is there anything else that you would like to say or pose to our guest today?
Yeah, I would just first, again, like to thank all of you for taking the time to join us today and to have this all too important conversation. And I would just like to close with one answer for each of you on the same question. What is one tip that you would like to give to family caregivers for their loved ones who may be dealing with a mental health issue? It could be a suggestive tip to seek help. It could be a tip for the caregiver to take care of themselves. Like, what would be that one piece of advice that you would like to give to viewers and listeners who may be going through this right now? And I'll start with Christina.
Find a peer-to-peer support group.
Thank you,
as a family.
Christina. Linda?
I would say educate yourself, know as much as you can about the diagnosis. If you know the diagnosis, know the person very well, and just try to understand. It's very hard to be angry with somebody or even dislike them if you really truly understand them.
Yeah, thank you. And I want to follow that up with, because people go on Google and sometimes they can go down a rabbit hole that's not good sound advice or factual. Where's a reliable, trusted resource that they could go to educate themselves?
About
Any sort of
about mental health. I would turn to NAMI.
Okay.
I would, yeah.
Thank you. Olivia?
Although it can be difficult at times, to just try to remember that it's a human to be taken care of, and not necessarily a behavior or a symptom or a disability, that it's a human that has to be taken care of.
Absolutely. Great advice. And Lori, what would you want to recommend?
I would say know that you're not alone. This is a much bigger issue than just you. So don't ever, ever think you are alone in this journey. There are people out there to help. And we will have in the show notes some places that you can reach out to as well. But there are going to be many more than what we list. And again, once you get connected to your tribe, you will be shocked at the comfort that you get and the insights and the tools and the resources. It's incredible. Absolutely incredible because people do want to help.
Yep. Thank you, Lori. And thank you again to our guests for joining us this month here on Conscious Caregiving with L&L. Thank you for joining us here for another episode of Conscious Caregiving with L&L, where we're tackling the tough conversations. We look forward to seeing you again here next month.